Louisa Wu.
Tēnā koe te mangai o te whare. It's my pleasure to speak on this, the third reading of the Health Practitioners Replacement of Statutory References to Medical Practitioners Bill. I want to commend the work, as always, of the Health Select Committee. I think it's a committee that works diligently on behalf of New Zealanders, and so I acknowledge their work on this particular piece of legislation. I just want to reaffirm for those who are listening that what this bill does is remove references to medical practitioners in 8 pieces of legislation to allow other suitably qualified health professionals or health practitioners, like nurses, to perform tasks that they are skilled in, that under current legislation they are not empowered to do. And some of those things actually I think should be highlighted. And though they are, for example, the ability to sign death certificates, the ability to take blood specimens from drunk drivers, they are about being able to declare people unfit to drive, they are about signing sick leave certificates, they are about prescribing controlled drugs, they are about issuing a certificate to accompany an application for a mental health assessment. So currently all those tasks are only able to be performed in legislation by medical practitioners. What this piece of legislation will do is to enable nurse practitioners and other health professionals, other health practitioners who under their learning, under their scopes of practice, who have the competencies, they too will now be able to perform those legislative functions. I want to acknowledge that the first nurse practitioner graduated in New Zealand in 2001. And actually it was in 2005 under my colleague, the Honourable Annette King, that we first started to look at expanding the legislative responsibility of nurse practitioners. And so we did that under a piece of legislation that enabled nurse practitioners to prescribe medication. And so what this piece of legislation does essentially is to look at the whole nursing area, and there are over 50,000 nurses in our country, and look at their skills and look at their ability to provide better services to the New Zealand population. And so at the heart of this piece of legislation, it is about maximising the strengths of the health workforce. I particularly want to focus on the issue of pay equity, actually, within this whole area, because I think it's really important now that with the expansion of the legislative scope that our nurses have, that we now look at remuneration. And so, for example, practice nurses in New Zealand earn between $31,000 and $45,000 per annum. If you're a registered nurse, you can expect to earn $65,000. And if you're a nurse practitioner, which we've heard has to undertake a master's essentially, so it's an extra 2 years worth of study, you can aim to earn over $90,000. Now, if we look at medical professionals, medical practitioners, a junior GP, so this is someone who spent 5 years studying at university, at med school, and then another 4 years to qualify, they can earn between $75,000 and $90,000 a year. And I'm sure other people will be able to talk more specifically about the remuneration. But a senior GP, so that's someone who after 10 years of both qualifying to be a medical practitioner and then working in the field, can look at earning between $180,000 and $250,000 a year. Now that's a huge difference between a senior GP and a nurse practitioner, which you'd say is a senior nurse. So senior nurse, $90,000 a year. Senior GP, but within between $180,000 and $250,000. So I think some of the implications from this piece of research, this piece of legislation based on my quick research of how much people are remunerated means that I think in the future we're going to see that our nurse practitioners are actually hugely underpaid. Because if they're performing now a whole lot of statutory functions and statutory responsibilities that previously only our medical professionals have been able to do, our doctors have been able to do, then actually there needs to be a reflection in their anticipated salaries. And the reason I'm bringing this up as quite a big issue for the House in the future is because obviously nursing has tended to be an area or a domain that women have chosen to study in and to practice their skills and contribution to providing the New Zealand public with the health services that they need. And so I'm highlighting it now because I think it's something that in the future we're going to have to address. This hasn't been about being pragmatic. This has actually been, I think, about fully utilising the skills of our entire medical workforce. But I certainly am, and I know after listening to Barbara Stewart from New Zealand First that it is something that is also now on their agenda. I only wanted to highlight that there was overwhelming support for this piece of legislation. So there were 28 submissions, only 2 opposed. One of those were from the medical practitioners themselves. I think that from their perspective, obviously preserving their status within the whole medical workforce was something that they were particularly concerned about, is probably the best way to describe it. I don't think they were trying to undermine the nurses' position, but I don't know, for people who have worked in the medical area, doctors always seem to have been at the top of the hill or top of the tree, and the nurses were seen as subordinate. But under this piece of legislation, actually, I see parity. I see our nurses and our doctors actually complementing one another and doing their job hand in hand, side by side, not one above the other. And I think that some of the role that our nurses will play in the future, and particularly in our rural communities, they will be leading the provision of health services. So I think that this piece of legislation is only really the beginning of another process and another evolution about how health services are provided in our country. And from the perspective of all nurses, so the Nursing Council, nurse practitioners, neonatal nurses, mental health nurses, from the pharmacy sector, physiotherapy, and even the unions who chose to make a submission on this piece of legislation, there was widespread support, and I think that support from the submitters has been reflected in the House. So I won't take up any more time. I commend the bill to the House.
Dr.